So now we're going to talk about some of the um, techniques to provide um, movement from a bone in the foot that's stuck in the dorsal position or jammed up. What we're trying to move it to is a more plantar position in the foot. The one that you see very, very commonly is the navicular. And what happens is that navicular gets jammed up, and because it's a dorsal glide, it will tend to rotate one way or the other. So it's not terribly important with the rotation, but what we're trying to do is find the plane of the joint to manipulate it into the foot. So you have to get some type of purchase on the foot so you can support the foot, the metatarsals against your leg. MCP border. The first, fix the talus. I'm coming right onto the MCP border of my second, and what I'm doing is gliding it to the table. There's the motion at the joint through a straight elbow, and so you could use that same technique for the medial cuneiform or the first metatarsal. If we're looking at the lateral aspect of the foot for a dorsally located bone, the one that's most common, you don't see it a lot, but is the cuboid. And the cuboid, I've seen in this position where somebody steps into a hole or jumps off a height and lands on their foot, and there's a obstruction, a rock or something they land on, and they jam this cuboid dorsally. So it's the same type of idea. You can block the foot. You can absolutely come onto the cuboid with this type of grip. You're coming on to this position on the cuboid. You're gliding it down, and again, the direction of force is probably 60 degrees off the vertical, and you're taking it down in medially in this position. So MCP in this position, there's the plane, straight grip,